Another type of fluoride that may be used in clinic is called DuraShield. It is a 5% sodium fluoride varnish. This would be used in times when you had very high caries risk or sensitivity with a patient. It comes in a pre-dispensed package. When you open the package, you will note that there is a brush that is included with it, and then there's a compartment that holds the fluoride. Because the varnish does separate, it's very important to be sure that you completely mix this varnish in very well. When you are placing this on this client's teeth, on the patient's teeth, you are going to want to start in the area with the most sensitivity and paint the buccal, the lingual, and the occlusal surfaces while maintaining a partially dry field. A little bit of moisture in the mouth is going to help the varnish set up. If there's too much moisture, this will start to get sticky before you're able to completely coat the patient's teeth. When you are finished, you'll want to rinse the mouth with water to help the varnish set up and to remove any excess flavor that might be objectionable to the patient. This is going to keep their teeth looking a little bit yellow for the next several hours, so be sure to give them that information. When they leave, send a copy of the directions along with them. They are able to rinse, eat, and drink right away, but they are going to have to be careful on eating hard foods and brushing their teeth for several hours. So be sure to include the directions when they leave.
We're going to demonstrate the isolation techniques in case we do a paint-on fluoride or we need the isolation for sealants. We are going to dry the area that we are going to isolate, in this case the upper right. I am right-hand dominant. Left-hand dominant person would be standing at the left side of the chair. After drying the area, I will be positioning cotton rolls on the buccal, and we'll have Mrs. O'Meara close just a little bit to help position those cotton rolls under the muscle of her buccal mucosa. And we're bringing the lip up and over the cotton roll in the anterior region. The fingers are divided so that the index finger is on the buccal, holding the cotton rolls, and that the middle finger is on the lingual to prevent the tongue from wetting the teeth. The saliva ejector would be positioned in the mouth to help keep the area dry. Mrs. O'Meara will turn toward me. She will have her chin up. The saliva ejector will be positioned on the right side of the mouth. The teeth are dried. Occlusal to buccal to lingual in a zigzag motion. And at this point, the sealant procedure would be proceeded with, or continuous application of fluoride for the recommended time. Continuous application for 4 minutes with the neutral sodium fluoride, continuous application for 1 minute with the acidulated phosphate fluoride. Cotton rolls will be removed from the buccal. When we isolate the left quadrant, we are going to be drying the area and then placing the cotton rolls. We retract the buccal mucosa, position the cotton roll in the posterior area and in the anterior area. If Mrs. O'Meara relaxes and closes just a little bit, it will help facilitate positioning the cotton rolls. The fingers are forked so that the middle finger is on the buccal in this case, and the index finger is on the lingual to prevent the tongue from wetting the teeth. Then we would proceed with the fluoride procedure after drying, or the sealant procedure. In the mandibular area, on the mandibular left, we will dry And position cotton rolls, one each on the buckle. And then 2 stacked on the lingual. And just make sure that the excess saliva is removed from that area. Please lift your tongue. Thank you. One cotton roll being stacked on top of another. Fingers are forked. Index finger is going to retract and hold the buckle cotton rolls, and the middle finger retain the lingual cotton rolls. Fluoride then, after drying, dry first and then apply the paint on fluoride or do the sealant procedure. Remove the cotton rolls. On the mandibular right, we would dry the area prior to applying or placing the cotton rolls. 2 would be applied to the buckle. And 2 will be stacked on the lingual. Please raise your tongue. In this case, the clinician, who is right-hand dominant, will be at 11 o'clock. The index finger will retract the buckle, and the thumb will be retaining the cotton rolls on the lingual. The area will be dried, and then the fluoride continuously applied for the recommended time.